is even in the healthcare profession is that we treat diseases. We don't treat the patient. We don't know how the patient is doing. So we say, oh, the breast cancer on bed 5, and that's the identity of the patient. The
Wow.
cancer on bed 5. But then when you take it a step further, you're dealing with somebody who they're faced with a disease. They don't know if it's terminal or not. They have lost their breast or part of it. They have to go through this long road of chemotherapy, radiation, and so on. And you don't know where their mental status are. They strong enough to continue? Are they breaking down? What is their coping mechanism? How are they going to manage this journey? Who do they have to live for to keep them going? And are they going to use this as an inspiration to make a difference? Many people get inspired, and that is how they start down the road of philanthropy. But then, so you have to start looking at the patient themselves. But then the other aspect of medicine is that nobody really cares about the relatives. So we treat the cancer, we treat the patient, but we don't treat the relatives. The relatives have to know what is going on. A lot of times, when you hear about negligence, it's not really negligence. It's just that poor communication, people left in the dark, and the bad attitude that they experience in both public and private. Because I've had complaints about private institutions as well. You have to talk to the relatives. You have to let them know what's going on. You have to discuss options, and you have to find out how they are doing because they're dealing with it as well.
Yes.
So I guess that's where it's coming from. Where I ask people how are they. But it's just something that I think we need to do.
About breast cancer awareness in Jamaica.
Mm.
You are very passionate about this issue of breast cancer awareness. You want to tell us why?
Well, I mean, I've said the story that, my own thing came from my mother's cancer. I decided that I was going to make a difference with cancer in Jamaica. And what I've found is that we just don't screen for cancer at all. So whereas cancer rates are going up in other parts of the world as well as Jamaica, and don't let anyone tell you that because more people are dying from cancer, it's a worldwide phenomenon.
Yes.
Cancer rates are going up worldwide, but in some countries, the death rate from breast cancer is falling.
Yes.
It's falling dramatically. And that's not just because they have better drugs. You have the same drugs available all over. You have the same treatment, the same surgeries, the same radiation available. What is making the difference is that they are screening and they're finding the cancer before it has gone invasive and before it has spread. We need to, so for example, America, when you talk about breast cancer, let's dial it back a little bit. What is a cancer? Throughout our lifetimes, our cells get old and die, and they have to be replaced by new cells. So you have one cell that breaks into two, and the cells are the units of anything in your body. And it splits in two. So imagine, say, an egg with a yolk, and it would split into two identical eggs with two yolks to replace cells that have died next to it. And then one of those new eggs, they're going to get old and die, and that new egg, another one, is going to split into two. And that is how you regenerate. That's how you get skin cells, your intestines, all of these different cells. In the case of cancer, one of those cells, instead of splitting and stopping and not splitting and growing anymore, like what normal cells do, they wait until other cells die, they replace them. These cells continue to divide so that one egg with the yolk split into two, split into four, split into 16, 64, and it goes on and on. When it gets big enough, that lump of cells is called a tumor. When it starts to invade into normal tissue, push into normal tissue, you get it as an invasive cancer. And then when it starts to spread, going through the bloodstream and so on to different organs where it lodges and starts to split into multiple cells again until it grows and takes over that area, that is what you call metastatic cancer. or stage 4 cancer when it's spread gone somewhere else. So in the case of breast cancer, it usually starts in the milk ducts, where you have the milk glands that produce the milk, and then the milk travels down these straw-like structures to the nipple. And the ductal carcinoma, which is the most common breast cancer, so the breast cancers, you can have lymphomas in the breast, you can have cancers of the milk glands themselves, but the majority is really cancers of the milk ducts. So the lining of that straw, that milk duct, they start to multiply, and then you call that ductal carcinoma in situ, or it's non-invasive. When it pushes through the straw and gone out into the fat surrounding the straw, that is invasive cancer. So that is invasive ductal cancer because it's coming from the duct. And when it continues to grow, so when you're talking about the different stages of cancer now, you're talking about the size and whether or not it has spread. So the invasive cancer, when it's less than 2 centimeters, that's stage 1. When you're gone into 2 to 5 centimeters and it's starting to spread a little bit to the nodes, which are under the arm, the axilla, Watson canal, we call it.
Yes.
You can have, early stage 2 or later stage 2, but stage 3 is when you have a tumor that's bigger than 5 centimeters. And it may involve the skin. It may go down to the chest wall where it's invading the muscles and the bones, or it may just make the breast swell up big and it look like an orange peel or a grapefruit when you look at it with the pimples on it. And that is you're going into your stage 3, and then stage 4 now is when and of course the lymph nodes get more involved as you progress. But stage 4 is when, as I said, it's spread to other areas. And for breast, it can spread to your brain, it can spread to your lungs, spread to your back, and can actually cause fracture of the backbones and spinal cord compression, so you can't walk or control your bowels and your urine, or it may spread to the liver. So these are the common areas that you'd expect some spread from breast cancer in stage 4 disease. So when you hear about breast cancer, and the first thing people ask is, how long I have to live? It's hard to tell because it depends on the stage. So if it's an early breast cancer, you're going to live longer than if it's a late stage cancer, stage 3 and 4. So this is why you want to catch the cancers early.
How bad is the screening in Jamaica?
It's terrible. It's absolutely terrible, and it shows in how our cancer patterns are. 90% of breast cancers in Jamaica are diagnosed with a lump.
Wow.
If you have a lump that you feel, it means that you have had cancer for over a year.
Wow.
About 18 months, versus if you pick it up on a mammogram before you start to feel a lump, that would really be early. So you're talking about 90% of cancers being caught with a lump, which means that you've had the cancers for a while. We're not picking them up with mammograms at all. Then when you look at the difference between early versus late, about 45 to 50% of breast cancers in Jamaica are caught at stage 1 or 2, or the non-invasive type, the early breast cancers. That may sound good to say, okay, you're catching half of them early, but in the US, that number is 85%. So only 15% of cancers are advanced. In Jamaica, it's about 50% of the breast cancers being advanced.
Wow.
Stage 3 and 4. So it is a serious problem, and that explains now, if you're catching 85% of your cancers at stage 1 and stage 2, you're going to cure those women, versus only half being caught early. You're going to have a higher death rate, which is why our death rate in the Caribbean and Jamaica is going higher. While in other countries where they're doing more screening and catching the early cancers, they're finding more cancer, so the cancer rate is going up. But the death rates are going down because the early cancers are easier to treat, cheaper to treat, and cause less harm on the body. So that is really why you want to screen, and we can't argue with the reality that
Mm.
women and their families are facing. We're just not screening enough. And when you look at the public sector, if we have 2 mammograms in the public sector, I think I said this to you 2 years ago when we were talking about this, we still have about 2 mammograms in the public sector. We have given a lot of lip service to screening, but we've done nothing. And during that time, we have continued to have an increase in breast cancer deaths in addition to the breast cancer diagnoses. So,
So where are we going to get to the screening? You're telling me they would have to go into private care to get a screening done.
and private care, it's the availability of the machines. I mean, my machine, I'm trying to get somebody to fix my machine for some time now. We have a national problem when it comes to maintenance. And then there's an affordability issue.
So on average,
How many people can afford?
on average, what is the cost for a screening?
I think Cancer Society is probably about 5,500 or 6,500. But ask how often they can get it, how long they take to get the report. I can't tell you. But the majority of other places, you have to pay. I mean, it goes as high as I think almost $20,000.
Wow.
So we don't have proper screening. We don't have a proper screening program, and we don't have access to screening in the public sector. And that's a big part of why we're seeing so many women dying from advanced breast cancers, because we're just failing them and we're catching it too late.
What is the mortality rate of cancer deaths in Jamaica presently?
And so it varies. Offhand, I can't remember, but it varies by stage. I can tell you the incidence. Breast cancer is the most common cancer among women and accounts for about 35% of cancers in women, of all cancers, with a lifetime risk of about 1 in 12 women getting breast cancer. But in terms of the death rate, I can't tell you offhand. And it varies significantly because, one, we're just getting around to a cancer registry to list everybody who has cancer. So it's just now we're getting proper data across the island. Before it used to be just KPH have their data, Cornwall, and then you may have Kingston and St. Andrew. So now we're compiling proper statistics. We can get a better idea of what is happening. But it varies depending on the stage of the disease. Stage 1 is much, much better than stage 4. But getting a cancer earlier at a stage 1 or 2, you decrease the risk of dying by 20 to 40% times. Sorry. Now, the other things that we have to look at is the age of the woman getting cancer. Younger and younger women are getting cancer.
Yeah,
and they're getting.
young?
So we would say that women over 50, women under 50 would be considered young. But then we are seeing women under 40, women in their 30s, and they're getting really aggressive disease. They are they're being diagnosed, and within months the cancer has spread, and in very short order they die in spite of chemotherapy, radiation, surgery, everything you throw at the tumor. One of the things we have to look at as well, outside of the stage of the cancer, is what you would call the grading of the cancer. So when a cancer cell divides, it tries its best to look like the mother cell that it's coming from.
Yes.
If it looks exactly alike or very close, imagine if you resemble your father. We'll say, all right, then that is a well differentiated cancer cell. They don't tend to be so aggressive.
Yes.
They don't tend to spread as fast, grow as fast, and the death rate is low. Then if you have a cancer cell that doesn't look like the father, call it in Jamaican terms, a jacket, it do look not like the father.
Yes.
Those tend to be bad because they don't behave like the normal cell. They tend to grow faster, spread faster, kill you faster.
Wow.
And they don't respond to the treatments as well as the more well differentiated cancer. So what we find is that younger women are getting these more aggressive, poorly differentiated cancers that don't respond to the traditional therapies, don't respond to the
What is
hormonal
the
therapy.
signs of this though, Dr. Dawes?
We don't know. It could be anything. It could be the food. It could be stress. It could be just the trace it with obesity, the rate of obesity going up, the rate of cancers going up. But we know that a lot of the risk factors like the smoking and the alcohol and so on, um, women don't smoke as much and drink as much as before. Anecdotally, I mean, smoking definitely. Um, and then there's the risk of not having kids or having less kids. That that is something that is a risk factor for getting breast cancer. So maybe that, but we don't know. Obviously the suspicions would be the food, the whole lot of processed foods and so on that we're having.